Magandang araw, Sock Sergeant! Welcome to our Talk with Doc series. At sa episode na ito, magbibigay kaalaman tayo sa pinakabagong serbisyong handog ng St. Elizabeth Hospital, ang bagong-bagong dental clinic. At kasama po natin ngayon ang dalawa po sa mga dentist na mag-aalaga sa inyo sa ating dental clinic dito sa St. Elizabeth Hospital. We have with us Dr. Carmela Porras and Dr. Michelle Garcia. Thanks for joining us. Doctors?
Thank you, Jay, for having us.
And thank you sa mga viewers natin for today. Good morning. Good morning.
Thank you. Doc, ano-ano po ba yung mga common na mga dental health issues na kinakaharap ng mga Pinoy ngayon? At paano kaya ito maiiwasan?
So, generally, Filipinos, the common problems that they usually encounter is number one, lack of awareness. So, for pagsabihin natin dental or oral, ang isipin agad ng mga tao is ibot or bunot. So, technically, there are other ways naman to preserve or to save our teeth. So, number one, if there's proper education, there will be less chances na for people to think na ibot lang ang services na offered by the dentist. So here at St. Elizabeth, along with Dr. Michelle Garcia, Dr. Roland Aliago, and Dr. Carlos Cirillo, we want to offer not just the services but also education. So we want to promote like oral awareness that there are other ways of preserving our teeth or other ways of dental procedures, hindi lang ibot.
Okay. So, the most na misconception is that the dental procedures are expensive, no? At saka yung makaka-avail lang ng procedures are yung mayayaman or like yung may kaya. But actually, pricey talaga ang dental na procedure kung hindi siya naagapan.
So, too late na?
Too late na. Oo, yeah, too late na. So, we want to inform everyone na the importance of your regular or your routine dental visits para maiwasan yung mas mahal na mga procedures. Sa lahat ng parte ng katawan, it's only the tooth ang walang ability to heal on its own. Unlike, for example, our skin, kapag nagka-cut tayo o magkasugat tayo, we know na gagaling siya, no? Mag-scar yan siya. But ang ngipin, kapag nasira siya, hindi na talaga siya oo, masisira na talaga siya unless na tatanggalin yung sira and then lalagyan siya ng restoration. So, the benefit ng pag-maintain is para maiwasan, ma-prevent yung pagkasira ng ngipin or dental decay.
Gaano ba kahalaga, doctors, na ma-maintain yung good oral hygiene? Bukod sa magbibigay ka syempre ng magandang smile, gaano ba ka-importante ito?
So, the importance of maintaining good oral health. First is we need to understand what is poor oral health. So, poor oral health means that we left the caries or gum disease untreated. So, as mentioned before in Dr. Michelle Garcia, that that tooth does not heal itself. So, it needs a professional dentist or professional help to help the tooth restore to its a healthy or proper way. So for good oral health, we have to first have good proper hygiene. We have to know the proper brushing technique. We also need to do diet, a proper diet, because of course we eat lots of sugar, chocolates, and then we don't brush our teeth, talagang will lead to poor oral health. And then also for gum diseases. So gum diseases we have gingivitis and periodontitis. So gingivitis and periodontitis, yan yung mag-brush tayo ng teeth, tapos tataka ka, hala, nag-bleed. So that's already a gum disease. So that is a disease that we should not left untreated. So wag baliwalain, no? So, pag meron ng ganun na signs, you have to visit na your dentist. So, technically, you don't visit your dentist only twice a year. So, this, di ba, ang pinaka-common or commercially ina-advise, visit your dentist every 6 months. But it does not mean na only every 6 months. So you have to visit like timely, make it a routine or regularly. So that's what good oral hygiene is. So that's everything general talaga siya.
Thank you, Doc Gian. So, eto naman, Doc. Could you explain some of the most common dental procedures na hindi fully na-understand o naiintindihan ng ating mga kababayan? At ang halimbawa dito, tulad ng root canals at saka yung dental implants. Ano ba yung mga ito?
Okay, so for example, so root canal is a root canal treatment. So ibig sabihin yan is if ang sira or ang caries, malalim na siya. So ibig sabihin hindi na siya kaya ipasta or it's too late. It's too late for pasta. And ibot, as you mentioned earlier, na ibot is not just the only service na ano. So we have root canal. So root canal is a treatment where we can save the tooth by retaining it inside the mouth. So that's root canal. So we remove kumbaga, the caries, the infection of the tooth inside, and then we can restore it and save it. So therefore, na hindi tayo magbunot. So, kasi what we want is kahit matanda na tayo, mag-abot tayo 60 years old, meron pa rin tayong ngipin. So, yan yung, that's what we want to spread or to educate people. And there are alternative ways.
Kailan ba dapat bumibisita ang bata sa isang dentist? At what age? And what can they expect during first visit nila sa mga dentist?
So the rule is kapag may tumubo na ng ngipin, they have to see the dentist, no? Or before siya mag 1 year old. Oo. So anong i-expect ng mga mommies, no, when they visit the clinic? Of course, we will do a check-up. No, titingnan natin kung ilang ngipin, tama ba yung kumbaga the position, the alignment ng ngipin. Meron ba tayong mga nakita na pwedeng ma-intercept, ma-prevent? Oo, so that at an early time may preventive na tayo na approach on how to really take care, no, on the oral health, at saka at an early age or at early time natuturuan namin yung mommies. Actually, it's really kasi of course ano lang siya, simple na check up, oo, but the awareness ng mother on how to care, the diet, the method on how to brush or to wipe. Oo, kasi at an early time, hindi may certain na mga toothbrushes or like materials na we can use or mga alternatives na pwede naming maturo sa mommies or the caretakers.
Thank you, Doc. Doctors, eto, medyo mabigat na tanong, kasi minsan binabaliwala natin yung ating good oral hygiene. Ang tanong ngayon, how does oral health relate to overall health? Yung ating, kung halimbawa malusog yung ating mga ipin, ibig sabihin din mo nito, malusog tayo overall as a person? Ano bang tingin nyo dito? Can you please further explain? At sa tanong na yan, may connection ba ang oral health sa mga conditions gaya ng heart disease or diabetes?
Okay. So our oral health really affects our overall health, no? Kasi hindi naman natin matatanggal yung bibig natin from our body. It's really part of the whole person. Bale, sabi nga nila na if one part of the body suffers, all parts suffers with it, no? So at saka vice versa. Pag may problema sa ngipin, ramdam yun ng buong katawan.
Sobra.
Oo. Yes. So, at saka, kung meron kang problema sa katawan, nagmamanifest siya sa bibig. Like for example, may diabetes ka, high risk ka for the gum disease. Oo. Yung bacteria na nasa bibig is the same bacteria na nagkukos ng rheumatic heart disease. Oo. So, it's really, your oral health really affects your overall health.
Bukod sa mga bata, syempre tayo mga adults, importante din ang maganda yung ating oral health. Ano? What are some specific oral health concerns for adults? And paano ma-maintain yung good oral health habang tumatanda tayo?
So, isa sa mga most common problem of adults is hindi nila na-i-enjoy yung pagkain nila because wala na silang ngipin. Oo. No? So, the only way na ma-prevent yan is you do your oral hygiene. You see your dentist regularly. Kasi the main function of our mouth is nourishment, pagkain, to communicate. At saka, when you get old, may mga other problem na tayo with the joints. Di ba, kahit may mga rheuma, so meron din tayo, may joint tayo na naka-attach ang ating panga sa ating ulo. And so, kapag tumatanda ka, tapos nawawalan ka ng ngipin, nagkakaroon ng imbalance dito. So, may iba na sumasakit, may difficulty sa opening ng mouth, mga ganoon. So, wag baliwalain na, matanda naman ako, okay lang, or ano. So, apektado kumbaga ang pagkain, ang pananalita, at talagang quality of life, the comfort, the quality of life.
Doctors, alam naman natin na ang dental care ay expensive o mahal, ano? Pero dito sa St. Elizabeth Hospital, ang kagandahan, merong PhilHealth coverage ang ilan sa mga dental health services natin, mga serbisyo natin dito. Can you tell us more about this?
So here at St. Elizabeth Hospital, we want to offer dental service for all. So as mentioned, one of our key points that we want to know is dental awareness and preventive dentistry, and also to offer procedures or dental procedures for the medically compromised patient. So as mentioned ni Dr. Garcia, yung mga undergoing cancer treatment patients. So also for indigenous people. So we also want to offer that. So how can we offer those kind of treatments? So here we want to introduce PhilHealth. So in PhilHealth, it can be covered. So the beauty there is, since halos lahat naman ng Filipinos or most are PhilHealth members, they can avail that. So not all people or the people of Jensan or South Cotabato or Region 12 knows that PhilHealth can be covered sa dental. So here, that's what we want to start. St. Elizabeth wants to start that PhilHealth can be covered sa dental. So if they have concerns and if they have worries about the financial, they can just go to St. Elizabeth, the dental service of St. Elizabeth, and inquire sa PhilHealth service.
So malinaw na mahalaga na bumibisita tayo sa ating mga dentist at syempre importante na naiintindihan natin yung kahalagahan ng oral health hygiene natin. Before we go, we would like to request some tips from and siguro yung mga paalala na lang ng ating mga doktor sa ating mga manonood.
To all the people of Jensan and South Cotabato, come visit St. Elizabeth. So we are 4 team members, so including Dr. Roland Eliago, General Dentist, Dr. Carlo Magpantay-Cirilo, our pediatric dentist, ibig sabihin sa mga bata, and along with Dr. Michelle Garcia and I, we are General Dentist and Hospital Dentist. We would like to invite you and come visit us. So we don't bite. We don't bite. So our cleaning schedule is from 10 a.m. until 6:30 p.m. So we can Mondays to Saturdays, and we are open. So we'll wait for you.
At dito sa St. Elizabeth Hospital, meron na po at bukas na po ang ating dental clinic. Kung kayo po ay may gustong ipa-check up sa ating mga dentist na nandito, pwede po kayong bumisita sa ating dental clinic. Nasa second floor po ng JCV Mat o ang ating Medical Arts Tower. Again, pwede pong i-cover ng PhilHealth ang ilan sa mga serbisyo na pwede pong na kino-cover syempre ng PhilHealth. Maraming salamat sa ating mga bisita ngayong episode na ito sa Talk with Doc series. Doc Chini, Doc Mitch, maraming salamat and thank you for joining us. At dahil special kayo, you have your beautiful flowers here, your beautiful bouquet. Yan, Jean. Thank you so much. Marami kaming natutunan sa inyo. Siyempre, I'm sure ang ating mga kababayan marami din ang natutunan sa inyong dalawa. At ako po kanyang host, si Jay Dayupay, na nagpapasalamat sa inyong pagtutok at nagsasabing at St. Elizabeth Hospital, your safety and well-being is our top priority. Doc, we cure, we care. Maraming salamat, Doc. Thank you.